Hello, my name is Michelle Bradley, and my presentation is about investigating the impact of health information integrity and validity on patient care quality and outcomes. And the reason I picked this topic was because I'm really intrigued about how health information, if done correctly, really impacts patient care quality and outcomes. But if it was not put in accurately, there is cases where it has significantly affected patients negatively. And I will show you here in my presentation. So the introduction of my presentation is that healthcare relies heavily on accurate and reliable information for effective decision making. It is very important to have accurate information in healthcare settings to have effective decision making because providers need relevant, accurate information for patients to decide on treatments, medicine, anything for a patient, and that helps patient quality care. The integrity and validity of health information are foundational to the delivery of quality patient care because it needs to be accurate and realistic. Here on the bottom is a little graph that I found saying that increased patient satisfaction leads to better adherence to treatment plans, which leads to greater treatment engagement, leads to better quality decision making, which all envelops how health information needs integrity and validity on patient care quality and outcomes. On this slide, we're going to talk about health information integrity and validity. And this is one of my main points in my essay and how it is important for patient outcomes. And so, on the bottom of the right bottom corner of this slide, there is data integrity. Data integrity is the accuracy, consistency, and context, which is important for patient health information. Health information integrity is making sure that the health information is accurate, complete, and reliable throughout its life cycle. On the top of this slide, there is validity, which is accurate and reliable. Accurate equals based on the proven facts, and reliable equals you can count on the source to give you correct information, which is true for validity, since health information validity is the accuracy and truthfulness of health information. It is also having the ability to represent reality. The significance in patient care is having correct information is important for informed decision making in patient care. This influences diagnosis, treatment, planning, medication management, and overall care delivery. The role of electronic health records, also known as EHRs, is that EHRs have a crucial role in maintaining data integrity and validity. Also, EHRs provide a storing and accessing patient information, reducing the risk of errors and discrepancies, and it also features such as audit trails and data validation mechanisms that can help ensure the accuracy and reliability of health information. And this shows in the bottom left corner of the slide shows this because the benefits of EHRs, but for physicians, the providers, shows that it helps reduce possible mistakes. It helps with marking, group management, reliability, regular updates, and history access, which all helps patient outcomes and patient quality of care. On this slide, it just goes back to the other slide about health information integrity and validity, and it shows data integrity and quality, and it shows how it correlates to decision making, data governance, contracts, record keeping, and security. With contracts, it helps with accountability and ownership, education and training, periodic data assessments. For record keeping, it is accurate, complete, timelessness, consistency between various systems, support payer, provider, or vendor agreements. For decision making is the provider utilization and payment, patient employee satisfaction. Security is error checking and validation, routines, data cleaning and maintenance, protect, recover, search, trace, and contact. And finally, data governance, patient care and treatment plans, record, retention, key performance indicators, and scorecards. These all really go into how data integrity and quality really helps patient quality care. And as you can see here for like patient outcomes and how patient outcomes can correlate into this, which is important of what I'm trying to say in my paper. On this slide, we're going to be talking about the impact on patient care quality. And first is misinformation of the health information can negatively affect the patient's quality of care, leading to medical errors. And there's an example that I really like, and it is a patient with a known allergy may receive a medication they are allergic to if their allergy information is not accurately documented, which, as you can see, if we investigate into this, is that if patient information is not adequately stored, it can lead to negative effects. And that's one of the topics in my paper of how inadequate information can lead to negative effects, but accurate information can lead to positive effects. Also, accurate data enables providers to make evidence-based decisions, ensuring optimal patient care quality and outcomes. Now, healthcare providers' reliance on adequate data for effective treatment plans. Healthcare providers rely on adequate health information so they can give patients a tailored treatment plan, which is really important. If we have adequate information, we can give patients adequate care, patient care quality, and we can give them treatment plans, medicine, anything if we had the right information. On this slide shows how if we have adequate patient information and how EHRs help with adequate patient information. And it helps by easier to access patient information, lower risk of theft of sensitive data, fewer mistakes due to handwriting, patient information updated and accessible in real time, and continuity of treatment. On this slide is the impact of patient outcomes. And I do have this on here, but I want to say that health information integrity influences patient outcomes, recovery rates, and overall well-being. Reliable health information is crucial for patient engagement and satisfaction. The importance of using reliable data for monitoring progress is having well-informed data is essential for monitoring patient progress and adjusting treatment strategies as needed. Effects of quality health information on patient engagement and satisfaction can help because patients will actively participate in their care and treatment plans if they receive adequate, timely, and understandable health information. On here, on the side, there's a graph that I found online which I really like, and it shows that patient-centered care helps improve patient outcomes. And if we have better patient outcomes, there's a reduce in patients that need to be hospitalized. And how patient outcomes are improved is trust between doctors and patients, higher patient satisfaction, patients are more likely to receive preventative care, better health outcomes overall, reduce healthcare costs, patients are active participants in their care. Engagement. Patients who participate in their care are 20% more likely to adhere to treatment plans, which is fantastic. And patients who are active in their care reduces hospitalizations, and patient-centered care reduces hospitalizations for ongoing care by up to 30%. I like those numbers. On this slide, this also shows the impact of EHRs on patient outcomes. And as you can see, with medication errors, percentage of improvement shows up to 48%. And access to critical information, 80%. Preventative care adherence, 30%. Hospital readmissions, 20%. And chronic disease management, 25%. I really like this graph. This graph that I found because you can actually see the improvement in percentages. And that's what I'm trying to show in my paper, how integrity, validity of health information and using examples like EHRs and giving you examples of negative outcomes can help patient outcomes, since we have to look at the dirty to look at the bright side. So in conclusion, my paper is about the impact of health information integrity and validity on patient care quality and outcomes. My paper, it highlights how integrity and validity is important for patient care, and it shows the negativity of inaccurate health information and patient outcomes and positive, accurate health information and patient outcomes. Also, the significance of maintaining accurate data in healthcare settings cannot be overlooked when considering its profound impact on patient care quality and outcomes. Upholding data integrity is not just a matter of protocol, it is very, very fundamentally important, and is a requirement for improving patient outcomes and ensuring the highest standard of care for your patient, for all patients. Healthcare professionals, providers, policymakers, and patients must recognize the critical role they play in upholding health information integrity for the betterment of individual well-being and public health as a whole. Because without adequate integrity, validity of a health information, we cannot give patients the care that they need, the treatment plans that they need, the medication that they need. And this is my presentation, and I hope you liked it. Also, here are my resources, and thank you for listening to my PowerPoint.